Hello everyone, my name is Gabby McKinnon and I work for the Hospital Council of Northwest Ohio, and I am the project manager for the Tuscarawas County Community Health Needs Assessment. This report provides an overview of health-related data for Tusc County adults and youth who participated in a county-wide health assessment survey from August through October 2021, and are based on self-administered surveys using structured questionnaires. The purpose of this PowerPoint presentation is to explain the design and methodology of the Tusc County Community Health Needs Assessment. We have two additional presentations released today that are split up by adult and youth data. HCNO has been conducting Tusc County's health assessments every 3 years since 2009. The point of the survey is to help analyze Tusc health trends and identify and prioritize health needs in the community. This report has been funded by the Adams Board, Cleveland Clinic Union Hospital, New Philadelphia City Health Department, Tuscarawas County Health Department, Twin City Medical Center, and United Way of Tuscarawas County. The following organizations are part of Healthy Tusc. I would also like to acknowledge the work of the Hospital Council of Northwest Ohio. The Community Health Improvement Division was responsible for project management, secondary data analysis, data collection, and report development. For those not familiar with the Hospital Council of Northwest Ohio, HCNO is a regional hospital association that represents and advocates for its members' hospitals. The Community Health Improvement Division has been working with Tusc County to complete their CHINAs since 2009. Our data analysis is completed by Dr. Joseph Dake at the University of Toledo, who is a professor and chair of the School of Population Health. Here's an overview of all the sections within the Tusc County Community Health Needs Assessment. It is quite an extensive report, being over 150 pages. If you would like to dive deeper into any of these categories after reviewing the additional presentation, I encourage you to do so. These individual presentations just give a small snippet of the data in these sections. Now I'd like to share some information regarding our methodology. First, looking at design. In 2021, the Healthy Tusc members came together to determine the content of the surveys for the adult assessment. The group reviewed master questionnaires to determine what questions they would like to incorporate. The committee really values their trend data since Tusc County has been completing health assessments since 2009. So this process is very important to ensure reliable and valid questions are being asked to Tusc County residents. Additionally, when selecting questions, the committee chose the majority of questions that come from national sources so we can directly compare Tusc County data with national and state data, as well as additional counties in the states of Ohio. Under Instrument Development, you can see the acronyms for these national surveys, which are the Behavioral Risk Factor Surveillance System, which is the adult data from the CDC. Again, it's imperative that we ask national questions to compare our data to really know how Tusc County is doing health-wise. Next, I would like to share the biggest part of our methodology, which is this procedure in which we collect data for the adult population. For the adult assessment, we send a mailing to Tusc County residents ages 19 and older. We retrieve addresses from a company called Melissa Data, in which we randomize prior to sending out the mailing campaign. Anyone with a valid governmental ID can be chosen. To give you an overview of the quantity, we sent the adult mailing out to 2,000 residents. This mailing campaign that I'm referring to has two parts. First, we send a letter to residents to let them know that they may have been chosen to receive a survey in the mail. This letter explains the purpose and importance of the Community Health Needs Assessment. Additionally, this letter was created on Healthy Tusc letterhead and signed by Healthy Tusc chairperson Sarah Guire. 6 weeks following, the same group receives a packet in the mail, which includes a letter explaining that the resident was chosen to partake in the survey, the actual survey that was created by the Healthy Tusc members, a $2 bill as an incentive to complete the survey. Additionally, the packet includes a posted page envelope to send the survey back to HCNO to analyze. The letter and survey explain that the survey is anonymous and there is no way to know who sent back the survey because they are not coded or tracked in any way. The youth procedure is a bit different than the adult assessment. Schools from various districts partnered with the Ohio Healthy Youth Environment Survey, also known as OYES, to administer surveys to youth in grades 7 through 12. OYES is a free, voluntary, web-based survey to collect information that schools and communities can use to access resources, to reduce risk behaviors, and create healthy and safe community, school, and family environments. Student participation is completely anonymous and voluntary. Students can skip any questions they do not feel comfortable answering. Parents who do not want students to participate are required to complete the opt-out form and mail it to the school or have the student return it to the school. A form must be filled out for each individual student. The time frame of this survey took place during 2 weeks in October of 2021. During the youth data collection, there was an increase in local school COVID-19 cases, which ultimately impacted the total sample size. Once the data was collated, it was sent to our statistician, Dr. Joseph Dake, for analysis. The next slide will explain how many surveys we received back and talk a little bit more about analyzing the data. This next slide is showing the adult and youth population that was surveyed and the response rates. As mentioned, we sent out 2,000 surveys. We run a power analysis which tells us how many surveys we need to receive back for the results to be representative of Tuscarawas County. Our power analysis number was 266 surveys, and we received 208. When you see the N with the equal sign, that is showing the total sample received. Please keep in mind that all of the responses were collected during the COVID-19 pandemic. The CI with the plus or minus sign is showing us our confidence interval. Most researchers shoot for a 7% confidence interval, and anything less than that is great. So most data you will see in articles or in the media has a 7% confidence interval. With a 6.78% confidence interval for the general population, our margin of error is plus or minus 6.78 for any data points you see throughout this assessment. As for the youth, the total sample size was 699 students, which ended up making up only 37.5% of Tuscarawas County's public school districts participating. During the collection of youth data in October 2021, there was an increase in local school COVID-19 cases, which ultimately impacted the total sample size. This slide will be looking at data analysis and survey IRB approval. First, touching on data analysis, Dr. Dake from the University of Toledo uses SPSS 26.0 to analyze our data. Specifically, Dr. Dake is able to weight the data, specifically the adult data, to accurately reflect Tusc County's population statistics. Just as an example, if the data came back 60% female and 40% male, and Tusc County's population is supposed to be 50-50, that is taken into account so it is as accurate as possible to reflect Tusc County's demographics. We also have an institutional review board out of Maryland who reviews all of our surveys, letters that go out to the community, and our methodology to ensure we are doing good research. Something that you will see throughout the adult report is social math. Social math is the practice that uses easy to visualize comparisons to make large numbers comprehensible and compelling. Using social math allows advocates to talk about statistics and data by placing them in a social context that provides meaning. We use the total Tuscarawas County adult population based on the U.S. Census, which is 57,957 adults. So for example, you will see 13% of adults were without health care coverage, and that is approximately 9,066 adults. Of course, there are always limitations to research. First, our data collection is self-administered via written surveys. The CDC collection differs in the sense that they still use telephones to call you and survey people over the phone. Also, the data is self-reported, as for the CDC. This data is not coming from actual medical records, but people reporting about their health themselves. Caution should be used when data is broken down into further categories because every time you do that, it is a smaller sample, and the margin of error is higher than the full population statistics. Since there were low response rates for those ages 30 and under, the age ranges are broken down by 19 to 64 and 65 and older. The results of the youth survey reflect student responses from the middle schools and high schools that voluntarily participated. I wanted to take a minute and specifically talk about how the COVID-19 pandemic affected the process of this community health needs assessment. First, data collection for both the adult and youth surveys did take place during the COVID-19 pandemic in August through October of 2021. With the COVID-19 pandemic affecting the lives of Tuscarawas County residents, uneasiness grew around data collection. As mentioned in a previous slide, the total sample size was only 208 residents, resulting in a 6.78% confidence interval. The youth population had a total sample size of 699, with only 37.5% of Tuscarawas County public school districts participating. During the youth data collection, there was an increase in local school COVID-19 cases, which ultimately impacted the total sample size. Now that we are done going over our methodology, I wanted to touch on our comparisons. The Community Health Improvement Division from the Hospital Council completes health assessments or health improvement plans in all of the counties shown in red. The next 4 slides are looking at our adult sample demographics. If you'd like to see more breakdowns, you can view the appendix of the full report. First is race and ethnicity. 96.6% of survey respondents are white, 4.3% are American Indian or Alaskan Native, 0.5% are Hispanic, other, African American, and Asian, and 0.2% are Native Hawaiian or other Pacific Islander. Second is marital status. 55.8% of respondents are married, 17.8% are divorced or separated, 15.4% are widowed, and 10.1% are never married or unmarried couples. Third is education level. 56.3% of respondents have some college or college graduates. 34.1% have a high school diploma, and 8.6% have less than a high school diploma. Last is income. 21.2% of respondents made $75,000 or more. 21.2% made between $74,000 and $50,000. 24.6 made between $49,000 and $25,000, and 19.7% made $24,000 or less. That concludes our methodology presentation for the 2021 Tuscarawas County Community Health Needs Assessment. Please check out the additional 2 presentations to get a brief overview on the health of the Tusc County residents. Thank you for your time, and please feel free to reach out to me via email with any questions.